Hello, I'm Dr. Terry Simpson with Your Doctor's Orders. Today we're talking about the Canadian healthcare system, so I'm going to tell you a little anecdote. While I was visiting in Canada, a neighbor had a foot problem, a diabetic foot ulcer, which had gotten infected. They went to the hospital, and at the emergency room they waited as they would in the United States, and they came home with two different intravenous lines. That patient was then given intravenous antibiotics twice a day with a visiting nurse twice a day to both check the wound and check the antibiotics and run them. They did not teach the family how to do that. In the United States, what would happen? You would still go to the ER, you would still wait, you'd get one dose of IV medicine and be sent home with maybe a nurse to see you once a week to check on the wound. This person got better care in Canada than they would have in the United States. Still had to wait in an ER like you would here. Here was the difference. So I started realizing that this system has to cost money. So I did some shopping while in Canada. I noted that the food costs in Canada were actually lower than the food costs here in Arizona, including the cost of lemons, which, face it, we grow here. The bottom line is the healthcare system in Canada costs less per person by almost half as what it does in the United States, and everybody is covered. In my article in the blog below on yourdoctorsorders.com, you'll see some of the statistics about wait times and how they are true and how they are misrepresented. Canada isn't a perfect system, but it costs about half as much as the United States and covers everybody. And many of the stories about the wait times are simply exaggerated. Take a look at the blog. Feel free to comment there. I'm Dr. Terry Simpson for Your Doctor's Orders.